So the ethics of medical practice. Why do you need ethics? Why do you need ethics?
guide your decision making and also
What is ethics?
the moral compass to
Moral
lead you
compass.
to
So why did you say to guide? Does ethics guide you for your decision
clinical practice.
or your clinical practice?
So you're not a
Who
virus.
should you save? The mother of a or the unborn baby?
Save the mom.
Who should you save? The mother or the unborn baby? Because if you try to deliver the baby, the mother will die. But if you don't, if you save the mother, the baby will die.
Now I think it's been possible. We save we work on saving the mom.
Mom, ah, mother, 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 both. Mother, mom, mom, ah,
Yeah, but if you try to save both and save none, and
we're not in a debate then. That was asked by our aunt to us. Our aunt is a pediatrician. No. And it was us to us when we were 9, 10 years old. And she was shocked on my answer. Because when she was asking, I said, I'll be the last one telling you what's my answer. So when I answered it, this is how I answered. I am not a god. I don't choose who to save. I'll save them both. If I don't save them both and one dies, at least win-win. Right? Try to save. You are not there to choose who you should save. Right? That's the ethical dilemma. At the end of the day, at least I saved someone. Because if you choose the mother to save and you didn't save the mother, what will happen? Trust me, you will carry that. You will carry the guilt of that. So that's ethics. So, medical and healthcare practitioners have diverse origin. In any regions, various regions, they have different. We have different medical practitioners in Western, in Chinese, right? Mostly Chinese, they go as what? Traditional medicine. What do I mean by traditional medicine? Those things and plant. They use herbal medicine. Western medicine, on the other hand, they use chemical medicines, right? And mostly in Chinese medicine, for example, you have headache, they'll just give you a herbal medicine. Western medicine, they will what? CT scan you. Yes, now they are becoming evidence based. Basis of medical ethics, foundation laid by what? Hippocrates. What is the foundation laid by Hippocrates?
The five pillars.
Again,
Five pillars. No.
No. Yes.
Do not.
Give me, yes. Do no harm. So the Hippocratic Oath enduring relevance in shaping ethical practice. Principle of medicine, medical ethics involved with what? Societal and legal influence also. There is also international codes of medical ethics. WMA, World Medical Association, established in 1947, showing international ethical standard in supporting the healthcare. Updates, publications in professionalism, patient care. What's the role of a doctor and what's the role, no, what's the duty of a doctor and what's the duty of the patient? Those things. Try to look what are the duties of a doctor and the duty of a patient. So, collaborates globally in ethical and guidance. There, as I told you, duties of a doctor. This maintain independent professional judgment and high standards. Should you choose your own patient? What if your patient was the one bullying you when you were in elementary?
Have the right to refuse treating a patient. In certain circumstances, I know some certain doctors firing their patients because they're like overstep the boundary. But in the setting of whereby somebody needs treatment and you suggest something of personal disgruntled, then it should not stand in your way in delivering.
What if the patient is in an emergency and you want to dismiss it and send it to the hospital, but when you send it to the hospital, the patient will die?
Yeah, you can't do that. You can only refer if you don't no longer wish to see the patient later on in a family medicine setting. And I just know of like a physician who did this. Uh, but in the general state, you have to handle your emotions, keep your personal and professional separate, and you have to act.
So what will you do?
I
See
would
the
treat
patient? Treat the
I would
patient?
I would treat the patient.
What if the patient said no? But if you transfer the patient, you know that the patient will die.
Yeah, like then no, I have to do my best to explain the situation to them as truthfully as I can. And if in lieu of that, they decide that they want to be transferred and not receive treatment from me, knowing the consequences, then that is their decision.
So you're afraid of your bully. Yes. Is that ethical? Is that ethical?
To,
You won't look at the patient, you won't give the management.
no, I will give it management and treatment. That needs to be done.
You know that happened to me.
What did you do?
It's not my bully classmate who was sick. It's the son of my bully classmate who was sick.
Then that's different entirely.
Should you see the patient even if the bully classmate doesn't want you to see the patient?
Depends if the child.
You are now breaking the protocol of doctor-patient relationship. If the patient doesn't want,
You can't.
should you do that or not?
Autonomy. No.
Autonomy.
The right.
But the problem is a pediatric patient. It's not the patient
Yeah, but
choosing
then
the
you have
doctor.
to, if it's underage, then you have to check with the parent.
Actually, what I did, I told him, explained everything.
Yeah, explain.
And I really told that classmate of mine, if something happens to your son, I'll be the one in liability. For that, I'll be liable. So please, let me do my job and let's discuss the past next after.
Yeah. Treat first, talk about it.
Yes. I tweeted this one.
And we can persuade and explain and encourage, but other than that, we cannot force.
Yes. Don't ask me what happened to my classmate. Again, I tweeted the sun. Don't ask me what happened to my classmate. Yes.
Voluntary admission when it's needed, even if the patient is refusing, but then the doctor can do that.
Is the patient's sound of mind.
Yeah.
You cannot follow the patient if the patient is not sound of mind.
That they don't have the insight into their disease.
Yes.
To be able to make an informed decision regarding that.
What's the sound of mind?
Competence of mind? Yeah.
Yes.
Aware
Stable,
state.
aware of the three spheres. What is the three spheres? Time, place, and person. So acts integrity, honesty, and dedication to patient care. Nurses. There is also professional conduct of nurses. And what's the role of the nurse? Are they the one should be treating the patient? Should they be the one suggesting the doctor what to do? You understood?
Depends.
Yes.
It depends. Say I'm a first year intern
Mhm.
and I'm working in OBGY.
Okay, you're the consultant and the nurse.
Oh, no. Depends who has been working there for longer. Like, I would take her experience into consideration, but that would not change my plan of management.
Mm. Especially during 2000, early 2000, right? There's a booming of nurse. They need a lot of nurses. And a lot of people went to the US and some of them were kicked because they were doctors, studied nursing. Confidentiality in medical ethics. What was that? Military discipline? Anything you see, you say, you hear, you feel, you touch, you taste, leave it here. But if you need to refer that, you need to ask what? Consent to the patient first. What is informed consent? Informed consent. Okay, I agree. You can operate on me.
Then the patient gets after being well versed and explained about
Yes.
and the potential dangers of certain
Without,
and signing a waiver.
no, without the signing or without signing?
Verbal consent is enough in Fiji.
Yes.
You don't need a
Sorry. In the Philippines, you need also what? Signature. So in conclusion, ethical medical practice relies on professionalism, integrity, and adherence to patient's right. Continual medical evolution of medical ethics reflects charging societal and legal expectations. Do you agree? A body is a message and the killer is the messenger. By the way, All exams will be SATA. Yes.
Is this from the movie Seven?
Yes.
Nine.